Hello everybody. First of all, I want to thank the organizers to give me the opportunity to present this work today. Today I'm talking about liquid biopsy biomarker based on extracellular vesicles. As you know, treating cancer using patient's immune system has become a reality today. Two major human checkpoint inhibitors are being developed, called anti-CTLA-4 and anti-PD-L1 PD-1. Today, I would like to focus my talk on anti-PD-1 and PD-1 pathway. Briefly, this pathway is an adaptive human resistance mechanism used by tumor cells. PD-L1 is commonly overexpressed on tumor cells and binds to PD-1 receptor on the activate T cells, resulting in inhibition of cytotoxic T cells. The human checkpoint inhibitor developed can block this interaction and restore anti-tumor human response. As you know, and as you can see here, immunotherapy significantly improves our survival. As a result, immunotherapy has become a standard of care for many cancers nowadays. If the antigens generated by this unprecedented result is important, there are several limitations to overcome. In fact, this therapy is associated with many toxicities. Moreover, only 20 to 40% of patients are responders. The main problem is there are not relevant markers for patient selection or assessment of response to treatment. Today, selection is based on the expression of PD-L1 in the tumor by immunohistochemistry analysis, particularly in lung cancer. However, these analyses have several major limitations, such as we cannot observe a lot of heterogeneity in the tumor. There are lack of consensus for positivity of PD-L1 status in cancer cells. Then, expression of PD-L1 can fluctuating with the time. That's why it's now very important to find a good biomarker in this file to improve treatment efficacy and manage cost. In this context, extracellular vesicle, called also EV, seems to be promising. EV are defined as particles that are released from cells, are diminished by lipid biolayer, and cannot replicate on their own. Both eukaryotes and prokaryotic cells can release EV. The first action to EV is now to facilitate intercellular communication in diverse cellular processes. Is it known now that EV are involved in many biological processes? The following here list is not intended to be exhaustive, but rather to demonstrate that the large variety of action in EV in the human's body. There are three main types of EV. Small EV with a diameter of less than 200 nanometers, medium EV, and large EV. EV are classified also with the composition, and as you can see here, you have different data, but if you want more data, you can see the guideline just published in JEV called MISEV 2023. In this project, we focus on small EV. Concerning small EV biogenesis, is mediated by the endosomal system. This formation involves four distinct sequential steps. As you can see in this picture, the first step consists of adenation of the plasma membrane, follow-up formation of the endosome, and after we have the formation in intradermal vesicle inside the multivesicular body. And last step consists of exocytosis of small EV. It's important to remember that in this picture, small EV has the same composition as the secreting cells. Therefore, small EV was identified as a potential circulating biomarker. Small EV biomarker has several advantages. First, we can see, just before here, we obtain the same composition of cell derived. Their small size between 50 to 200 nanometer means that it can easily penetrate biological fluid such as blood and urine, which constitute a very good modality, non-invasive modality for patients. They are also found in very large quantity in the blood, between 10 to the power 9 and 12 per milliliter of blood. Their structure, in particular the presence of the plasma membrane, protects their compounds from degradation. Finally, they can also obtain the good reflect of tumor heterogeneity better than a tumor biopsy. So now, because PD-L1 is found on the surface of cancer cells, you can easily now understand that PD-L1 has the capacity to be found in small EV secreted by cancer cells. So, in this way, we therefore hypothesize that small EV PD-L1 could be used as a biomarker to improve patient selection and follow-up. To prove this, we conduct a prospective clinical trial with 3 hospitals in France. We enroll 146 patients with advanced melanoma or Merkel cell carcinoma or lymphoma. For each patient, 5 ml of blood were taken at different times, at diagnosis, during treatment, and at tumor evaluation. Then, small EV were extracted by ultracentrifugation and characterized by classical NTA and Western blot. Moreover, the concentration of PD-L1 in small EV was quantified by ELISA. First, we confirmed the presence of small EV using Western blot techniques by analyzing specific biomarkers to small EV, such as you can see here, Alix, CD63, TSG101, and CD9. Analysis by NTA and TEM confirm a consistent size for small EV around to 100 nanometers. Next, we show the presence of PD-L1 in Western blot, as you can see here. We also found a much lower concentration of PD-L1 in Merkel cell carcinoma patient by ELISA. So, we can therefore conclude that all patients express PD-L1 in circulating extracellular vesicles, regardless of their tumor profile. Then, we focus more on the melanoma cohort. We compare PD-L1 expression in free plasma versus in small EV. As you can see in the histogram here, we observe a significant difference that shows the superiority of measuring PD-L1 in small EV. Next, we compare the expression of PD-L1 in the tumor versus in the small EV. As you can see in the last figure, interestingly, we observe that 100% of patients express PD-L1 in the EV, while only 67% overexpress it in the tumor. So, PD-L1 detection in small EV is more sensitive than free PD-L1 in plasma or in the tumor. Now, we accept the variation of PD-L1 in patient bloods according to disease stage. In this histogram, you have different color. In red bar, it's for no responder patients, and green bar, it's for responder patients. As you can see here, we show that a decrease in PD-L1 small EV concentration in all responders patients. Moreover, when you check the size and also the number of small EV in the patient in function responder or progressor patient, we can see no differences. So, we can conclude that we observe the variation of the concentration of small EV, as you can see here, is associated with tumor response. On PD-L1, it's a very good biomarker for that. We then determine a cutoff of delta PD-L1 small EV. This value was set up at 100 picogram by milliliter. Progression-free survival and overall survival are better predicted by variation below this cutoff. Then we can suggest that PD-L1 small EV is associated with tumor response and can predict patient outcome. Here I show you the example of patient monitoring with PD-L1 small EV. As you can see here, you have the variation of PD-L1 during the time and during the treatment, and we can see here the medical imaging. So we can see the decrease of PD-L1 concentration associated with the tumor response in this case. And the contrary, I show you the patient with brain metastatic progression, and you can see the increase of PD-L1 concentration with this progression. So we can conclude that PD-L1 small EV monitoring could be used to detect disease progression or response in anti-PD-1 PD-L1 treatment. We also see a correlation between response to treatment on PD-L1 level when we follow patients with lymphoma. You can see here on the up the responder patient, and on down you can see here the result for no responder patients. I would also like to draw your attention to an interesting point on this slide, specifically the point at which the disease relapses. As you can see here in green, we can see that PD-L1 level also increase during relapse. So, even though this result needs to be confirmed in each cohort, this marker also seems to be very interesting for predicting relapse in this type of disease. Now, I would like to present a special case of progression disease in context of immunotherapy, called pseudoprogression. Pseudoprogression corresponds to an increase in the size of the lesion seen on the CT scan, simulating progressive disease. In fact, this increase in size is due to infiltration of various human cells, such as lymphocyte T, into the tumor, corresponding to a response to treatment, and in this case it's very important to continue anti-PD-1 treatment. Until now, it has been impossible to distinguish true progression from pseudoprogression. We therefore analyze CT circulating PD-L1 level in this patient. So, as you can see here, we observe a sharp drop in PD-L1 level at the time of pseudoprogression, 42 here, which, according to your previously presented result, corresponds to the response to treatment. Interestingly, we continue to follow up this patient and observe 9 months after pseudoprogression a true progression that was also clinically confirmed and correlate with a sharp increase, as you can see here, of PD-L1 and small EV. So we can conclude that PD-L1 small EV could be also help to distinguish pseudoprogression from real progression and guide physicians in managing patients. To conclude this project, in different cohorts, we have demonstrated the feasibility of small EV PD-L1 analysis. We compare to soluble protein on tumor biopsy. We have also demonstrated the added value of small EV PD-L1 analysis. Finally, we have shown a correlation between variation on small EV PD-L1 and tumor response or relapse. Moreover, we have shown also PD-L1 small EV seems to be independent to tumor subtype, and also can be discriminate pseudopropagation. So this all result provide a good rationale to develop circulating small EV PD-L1 as a predictor of response or clinical outcome to anti-PD-1 PD-L1 therapy.
For the rest of this work, we need to confirm this result in large cohort. We also want to investigate other cancers, such as lung, colon, bladder, and also breast. We have recently started work in lung cancer cohort with a study EV in 58 patients with baseline blood sample. And we can see that we observe in this graph here the presence of PD-L1 in all patients. So we confirm the feasibility to study also PD-L1 small EV in this case. And now we are ready for analysis the follow-up time point for this disease. We hope obtain the same result with melanoma and also lymphoma, just as that we obtain the degrees of PD-L1 with responders patient to immunotherapy. We hope so for that.
In this work, we have demonstrated an association between increase of small EV PD-L1 and no response there to anti-PD-L1. This raises to more fundamental questions about the role of circulating PD-L1 play in resistance to anti-PD-1 PD-L1. We therefore wanted to see whether the PD-L1 in small EV, like a cancer cell, was biologically active. First, we sought to demonstrate the presence of PD-L1 off the surface of small EV. To do this, we developed a protein-protein interaction technique based on biolayer interferometry analysis. Briefly, biosensors are functionalized with anti-PD-L1 and then put in contact in small EV. The differences between incident white light and reflect beams can be measured the protein interaction with antibody. Then the signals was processed to obtain the binding curves. We analyzed small EV from melanoma and lung cancer patients and observed the presence of PD-L1 on the surface of EV in both cases, compared to control patient. So we can conclude that small EV can also express as cancer cell PD-L1 at the surface. Next, we try to observe the biologic function of small EV PD-L1. We therefore co-culture cancer cell with, in this case here, human melanoma SKM2 or small EV derived from it with T cells. After 48 hours of co-culture, we use flow cytometry to analyze various parameters of T cell activation, such as PD-1, Ki67, and interferon gamma. We can see here in this graph, the last second line, that the effect of small EV is identical to that of cancer cells on T cells. So we can conclude that, like cancer cells, the PD-L1 small EV appear to block T cell activation. In the light of this result and in a clinical context, we can therefore imagine that the effect of small EV PD-L1 on T cell could be early and more distant than that on the cancer cells, which are mainly confined to the tumor microenvironment. In fact, T cell blockage could be occur well beyond the tumor microenvironment in the bloodstream and also at the distance in, for example, lymphoid organs. The peripheral blockage will therefore block T cell at an early stage, before they rush to the tumor site. This hypothesis fully supports the result we present today, showing an association between high level on increased PD-L1 in small EV and resistant to anti-PD-1 and PD-1 drugs. From my point of view, EV is more particular of great interest in this field of personalized medicine in oncology, with application as a biomarker for diagnosis, prognosis, and response prediction. We're always looking for PhD students and postdocs. We've been delighted to welcome you to your beautiful region. To finish, I want first to say thank you for your attention, and I would like to thank all of my teams and all of my collaborators, as well as all of your funders.